Now to Indiana, where the first new abortion ban passed by a state legislature since the overturning of Roe versus Wade will take effect. Abortion clinic operators had filed a lawsuit to keep the measure from going forward, but a state judge denied the request. CBS's Adriana Diaz has the latest from Indianapolis.
This is an area that would normally be full of patients.
Most of the lights are now off at Women's Med, an Indianapolis abortion provider.
As a physician, I get mad because insurance companies deny claims. I'm not normally mad because my patients are being stripped of human rights.
The clinic is among 2 Indiana providers slated to close. The state's 5 remaining clinics will still offer limited health care. Dr. Katie McHugh says patient volume doubled here as more restrictive abortion laws were passed in neighboring states.
And we were able to support the states around us and take their patients and provide the care that they needed. That all happened until yesterday.
Indiana is now one of 13 states with a near total ban or that have outlawed abortions after 6 weeks.
It's an exciting day for Indiana.
Sue Liebel is with Susan B. Anthony, Pro-Life America.
Now it's back in state hands. It's going to be messy. It'll be different in every state, but it's closer to the people, closer to the will of the voters.
Women's Med will now send Indiana patients to its sister clinic in Dayton, Ohio, more than 100 miles away, where just yesterday a county judge temporarily restored Ohio's abortion access.
When you look to the future, what do you see?
I see so much harm on these populations that will not be able to access abortion care. And I think about the generational damage that will be done to these patients and their families.
Adriana joins me now. Adriana, you mentioned that some of the clinics in Indiana are still staying open. Could they perform then the abortions in the limited instances that are allowed by law?
They absolutely cannot, John. The limited exceptions are in cases of rape, incest, a threat to a mother's life, and only if a woman is 10 weeks pregnant or less. And in those rare cases, abortions can only be conducted in hospitals. No longer can abortions be conducted in outpatient centers like this one. And we looked at the statistics last year. 99% of abortions in Indiana took place in outpatient centers. One other thing I want to clarify is that, as you mentioned in the intro, today a judge said that they denied a request to temporarily block this ban while lawsuits play out. We're now also learning that they've essentially denied that request to make that decision today, but the decision could be made for an injunction on Monday when there's a hearing. So things are still a bit up in the air. This ban could last 4 days or it could last indefinitely.
And so does that change? I mean, should we expect future challenges, other legal challenges now, even though this is in sort of legal limbo with this judge's decision?
There are 2 lawsuits that have already been filed in this case. We can always expect more. I mean, what all of these legal changes have done, and people on both sides told us this, is that it's raising the awareness, it's increasing conversations about abortion and the legality of abortion. So that renewed attention is just bringing more legal scrutiny to this issue as things change state by state. And, they're changing by the day, they're changing by the hour, and they're flip-flopping. In the case of Indiana, this center behind me had patients from Dayton, Ohio, where they have a sister center, coming into Indiana for abortion procedures up until today, because for a time the laws in Indiana were looser than they were in Ohio. That changed. Ohio, yesterday, there was a temporary injunction where a judge loosened the rules in Ohio for 14 days. So now this center is sending its Indiana patients to Ohio. So there's really a convoluted, confusing patchwork of laws.
We're grateful you're helping us try to sort through it, though, Adriana. Thank you. Adriana Diaz in Indianapolis.